Hello everyone and welcome to the first video of Survey of Anatomy and Physiology. So there's going to be lots of videos here made in Survey. This is just, we're getting a general overview of anatomy and physiology. It's not going into the details like Anatomy and Physiology 1 and 2 course will go into. We're going to be covering all the systems and just giving a great general overview. So after watching all these videos and going through this course, you should have a great understanding of your bodies and anatomy and physiology. So in this first video, in order to talk about anatomy and physiology, we have to go over what is anatomical position, the language of directional terms for how we describe things in relation to other things in the body, and then we'll also talk about body planes and different sections you can make when looking at some of these anatomical figures and things like that. So this first video here is kind of our language of anatomy. So, like I said, we're just going to do an overview of what is anatomical position, and then we're going to look at the terminology of directional terms, and then also quickly identify the three body planes. So here, first up is anatomical position. In the next video, we're going to go into details of all of these regions. So don't worry about those right now, but right now we're just focused on anatomical direction. As you can see, this individual is standing straight up, so erect, and then feet are facing forward, and palms are facing forward as well. So you could have your hands like this or your hands like this. And you notice palms are facing forward because when your palms are facing forward, I know it's not forward now, but imagine me down, your radius and your ulna here are parallel. If you were twisted over, now your radius and ulna are crossed over each other. So anatomical position keeps the radius and ulna parallel right here. So the radius would be more lateral and the ulna would be more medial. And we'll talk about those two terms coming up here in a moment. So this is anatomical position. And so when you're describing things in relation to other things, you're describing them from this frame of reference. And this frame of reference is important for describing things to other people, especially in nursing and things like that. If you are taking notes on where something hurts or something like that, you need to describe it in relation to other things. So that's anatomical position, and most models are presented to you in anatomical position for the images in the book here. Alrighty, so that is anatomical position. Now, next up are different directional terms. So these are the terms, let me zoom out a little bit here so we can see this whole image, that we use to describe the individual that you are observing. The first two terms are right and left. If you notice as you're looking at this, it's opposite than what you think. Because of course, when looking at this, this is my right and my left. But remember, it's not you. So this is wrong. It is the individual of what you're observing, not the observer. Because if you say this individual has a right broken arm and you're looking at them and it's your right side, that would be right. However, their right arm is right here. So, excuse me, that would be incorrect. So you got to remember, right and left is of the observed, not the observer. So that's the first two, right and left. Next ones are how we state when something is above something or something is below something. There are two different sets of terms we can use here. The first two are cranial versus caudal. Cranial specifically means towards the head, the cranial region. Caudal means towards the tailbone, so towards the caudal region. And so that's kind of limited between the head and the tailbone here. However, say you're describing where the feet are compared to the abdomen. That's a little bit more difficult to do using cranial and caudal. So you use these other two terms, superior versus inferior. So superior is above, inferior is below. So you could say the neck is superior to the abdomen. The abdomen is inferior to the neck. So if you're using superior, you then also use inferior. If you're using caudal, you use cranial. Typically, we see superior and inferior. And when we're describing the bones and things like that, we'll be saying this is the superior side of the bone, this is the inferior side of bone, especially on something like the clavicles or the collarbones right here. You want to know what side is the upper side, what side is the lower side. So that's above and below. And think about different sentences you can make while talking about these terms as well. Now, what if something is to the front or to the back of? You don't use in front of and back of when we're talking about it in general terms. So if we're looking at a front view of a model or an organ, we would say anterior or ventral. So this is front. Compared to posterior or dorsal, which is towards the back. So anterior goes with posterior, ventral goes with dorsal. So anterior front, posterior, you lean up against a post, which is on your back, or dorsal fins are on the back, ventral, you vent from the front. So two different terms here you can use for each one. Typically, we see anterior and posterior when talking about these, though. I'll show in a model image coming up later. I mean, even right up here in this image, here we have an anterior view. So whenever you look at image descriptions, they'll be stated what view they are in. And then over here, we have a posterior view, which is the back side. So you want to look at that when making the decision of what side of the model you're looking at. Next up is how we describe things on appendages. So all appendages have a point of origin and then a more distant area. If it's closer to the origin, it is known as proximal, closer proximity. If it's more distant or further from the origin, it is more distal. So for the arms and the legs, we have those terms, proximal and distal. So if I was describing the knee in relation to the ankle, the knee is proximal to the ankle, or the ankle is distal to the knee. You could describe that any way you want. You could even say the fingers are distal to the wrist, or the wrist is proximal to the fingers or the digits. So you could use different terms there. Now, if you're comparing the foot to the abdomen, you're now leaving that point of origin, so then you would use superior and inferior. Now, the last ones here are medial and lateral. So medial, you got to imagine there's an imaginary line going down the middle of the body. So if something that's more medial, it's more towards that midline compared to something that's more lateral, which is towards the side. When you do a lateral in football, you throw the football to the side. So that's a lateral. So here I described that earlier. The radius is right here. The ulna is right here. So the ulna is more medial. The radius is more lateral for the bones in the forearm. Also, you can sometimes use a term for something that's in between medial and lateral. Say you're describing the relationship of the shoulder, collarbone, and the sternum. So you could say the collarbone is intermediate to the shoulder and the sternum or the breastbone. So that intermediate term can sometimes be used as well. The other one we can sometimes see is superficial versus deep. Superficial is more towards the surface, and deep is more interior. So the skin is superficial to the muscles. The muscles are deep to the skin. And a common term that we're saying is arteries typically run deep, veins typically run superficial. Arteries are a higher pressure. If you cut an artery, you're going to lose a lot more blood, so they run deeper as a protective mechanism. So these are our directional terms. We use these when discussing things in relation to other things. We don't say under, above, in front of, next to. We don't really use those terms when we're talking anatomy and physiology. This is the language we use right here. And when naming things like the bones and muscles, these become very important. Last thing I want to talk about today are our body planes. So body planes are when you take what's called a section. You're looking at either the body as a whole, a particular organ, in a different plane that's slightly off of the anatomical position. So the three planes are the sagittal plane, the frontal, sometimes called the coronal plane, and the transverse or horizontal plane. The sagittal plane, first one here, goes right down that midline. So sagittal is separating left from right. So you get the left side of the body, right side of the body. So then every now and then you might have a sagittal plane. So median sagittal is directly on the midline. Parasagittal could be somewhere over here. And depending on the section, so when we make a cut, it's called making a section. could be off the midline and so forth. It all depends on the organ that you're looking at for that particular orientation. And now frontal or coronal plane, so frontal for front, separates front from back or anterior from posterior. So we see a lot of these frontal or coronal sections for looking at a lot of organs because it kind of cuts the organ in half, anterior from posterior. And I'll show that in a model coming up next. Next up is the transverse plane. So transverse plane is a horizontal cut separating superior from inferior, so above and below. Now, if it's directly across at 90 degrees, that's sometimes referred to as a cross section as well. If it's at an angle, it's known as an oblique section. So these are just important terms when looking at images, and you can understand the description and the orientation of that particular model. So here's one example that brings a lot of what we just talked about together. So this is the heart. This is an anterior view of a frontal section. So this is where all these terms are important. So an anterior view. It even shows you the section right up here, the plane through the heart on where it was taken right there. So it cut that piece off on the anterior front side of the heart. So anterior view would be the front facing side. Frontal section means it cut the heart in half, separating anterior from posterior. So this allows us to see the internal workings of the heart. Other things we see on this heart are the difference between right and left. Over here, me observing this is the right side or the right atrium. However, it is the left atrium. Remember, you got to imagine this heart in the individual. So there's the left atrium, left ventricle. Then over here, we have the right atrium, right ventricle. So this is the right side, and then this is the left side over here. Opposite from what you might observe, because you got to remember this is in the individual. And same thing up here when it comes to naming the arteries and veins going to and from the heart right here, they get left versus right switched as well. So this kind of just brings the left versus right part together and also shows us an anterior view of a frontal section, kind of brings all the terminology together here just in one little image. So a great little image there. All right, so that's all I have for this first video here, introducing us to anatomical direction and directional terms, and a little bit covering body planes. In the next video, we're going to be going into all the different body regions and how they will help you name bones, markings, and things like that in different muscles throughout the rest of the course. But that's all I have for today. Thank you for watching. If you have any questions, be sure to let me know. Alrighty, bye-bye.